Imagine sitting in a doctor's office and hearing that you are at risk for heart disease, diabetes, and even some kind of cancers. But not because of something you caught, but because of excess weight your body has been carrying over time. According to the Centers for Disease Control and Prevention in 2024, more than 42% of adults in the US are obese. That is nearly half the population. Obesity is not just about physical appearance, it's a serious medical condition that can affect almost every system in your body. Today, I want to inform you about what obesity is, what it causes, how it affects health, and the ways it can be prevented or managed to improve quality of life. Obesity is defined as having an excessive amount of body fat that may harm health. The National Institutes of Health explains that obesity is typically determined using body mass index, also known as BMI, where a BMI of 30 or above is considered obese. While BMI does not measure fat directly, it is the most widely used tool to estimate obesity in adults and predict health risks associated with it. There are many different causes of obesity. It is not just about eating too much. According to the World Health Organization, in 2023, obesity is influenced by a combination of genetics, environment, and behavior. Some people are genetically more likely to gain weight because their bodies store fat more easily. Lifestyle is also a major factor. Today, many people consume highly processed foods that are high in calories, sugar, and unhealthy fats. At the same time, physical activity has also decreased due to more screen time, office jobs, and busy schedules. The National Institutes of Health also notes that stress and emotional factors can lead to overeating, especially when people use food to cope with anxiety and depression. So, obesity is not simply the result of poor choices, it is a complex condition with multiple causes. The health effects of obesity are serious and wide ranging. According to the American Heart Association, which is cited by the CDC, obesity greatly increases the risk of heart disease, which is the leading cause of death in the US. When their extra body fat makes the heart work harder, leading to high blood pressure and high cholesterol. Obesity is also one of the main causes of type 2 diabetes. The CDC reports that the majority of people with type 2 diabetes are overweight or obese. When there's too much fat in the body, it becomes resistant to insulin, which causes blood sugar levels to rise. A peer-reviewed study published in the Journal of the American Medical Association by Flegel and the colleagues in 2013 found that obesity is associated with a significantly higher rate of early health due to conditions like diabetes, cardiovascular disease, and cancer. In fact, the World Health Organization states that obesity increases the risk of at least 13 types of cancer, including liver, kidney, and breast cancer. Beyond physical disease, obesity can also impact a person's daily life. People with obesity often experience joint pain because the extra weight puts stress on the bones and muscles. Sleep apnea, which is where breathing stops in your sleep, is also more common in individuals with obesity. Mentally, obesity can lead to low self-esteem, and depression, especially when people face social stigma. The constant health challenges and emotional effects can reduce a person's quality of life over time. The good news is that obesity is preventable and manageable. According to the World Health Organization, small lifestyle changes can make a big difference. Eating a balanced diet that includes fruits, vegetables, lean protein, and whole grains can help reduce weight and improve overall health. The National Institutes of Health recommends getting at least 150 minutes of moderate exercise per week. This does not have to be intense. It can be activities like walking, biking, or dancing. Getting enough sleep and managing stress is also important because lack of sleep and high stress levels can increase hunger and lead to weight gain. For individuals who already struggle with obesity, there are many treatment options. The CDC notes that even a small weight loss of 5 to 10% of body weight can significantly reduce the risk of developing diabetes and heart disease. For some people, medical treatments such as prescription medications or weight loss surgery may be recommended by healthcare providers. These are not quick fixes, but tools that can just help with combining healthy lifestyle changes. Obesity is a serious and widespread health issue that affects millions of people in the United States and around the world. It is caused by a mix of genetics, lifestyle, and environmental factors, and can lead to major health problems such as heart disease, diabetes, and cancer. However, the most important thing to remember is that obesity is preventable and it's manageable. By making healthier food choices, staying physically active, seeking medical support when needed, individuals can improve their health and reduce the risk of serious disease. According to the CDC, even losing a small amount of weight can lead to big improvements in health. Obesity is not just a personal issue, it's a public health issue that affects all of us. By understanding it and acting, we can create a healthier future.